Ever been struck by a throbbing, pulsating headache that seemed to take over your entire world? That could have been a migraine. A migraine isn't just an ordinary headache, it's a neurological condition characterized by intense, debilitating headaches that can last anywhere from 4 to 72 hours. The pain isn't just a dull ache, it's often described as throbbing or pulsating, and it typically affects one side of the head. But it's not just the pain that sets migraines apart. They can also come with a host of other symptoms. Some people experience nausea or vomiting. Others become extremely sensitive to light, sound, or even certain smells. And for some, physical activity can make the symptoms even worse. So in a nutshell, migraines are severe, often debilitating headaches with a variety of additional symptoms that can significantly impact a person's quality of life. Migraines are not an isolated phenomenon. Millions of people worldwide experience them. Let's delve into the epidemiology of migraines to understand who is most affected. Research shows that migraines are more prevalent in females, with 18% of women experiencing them compared to just 6% of men. This could be attributed to hormonal differences and the biological variations between the sexes. Interestingly, the frequency of migraines decreases with age. This is especially noticeable at the time of menopause. The decrease in estrogen levels during menopause could potentially explain this decline. However, it's important to note that migraines can occur at any age and are not exclusive to a particular gender or age group. So while anyone can experience a migraine, they are particularly common in women and tend to decrease in frequency as we age. This knowledge can help us to better understand, diagnose, and manage migraines in the future. The exact cause of migraines remains a mystery, but there are some theories and known triggers. One theory posits a phenomenon called cortical spreading depression. This is essentially a wave of depolarization, or a sudden change in electrical charge spreading across the cerebral cortex, the outer layer of the brain. This may cause an aura, which is a set of visual symptoms due to the wave passing through the occipital cortex, a part of the brain dedicated to vision. This wave may also activate the trigeminal nerve, which is responsible for sensations in the face and motor functions such as biting and chewing. Another theory suggests an association with vasoconstriction and dilation, which is the narrowing and widening of blood vessels respectively. While these theories are still being explored, there is a significant genetic contribution to migraines. Yes, migraines can run in families. Now let's talk about triggers. These are elements in our environment that can set off a migraine in susceptible individuals. These include stress, changes in sleep patterns, certain drugs like estrogen and nitroglycerin, hormonal changes, and even withdrawal from caffeine. Some foods have also been identified as potential triggers, including chocolate, tyramines found in red wine, and nitrites found in processed meats. While the exact cause remains elusive, it's clear that both genetic factors and environmental triggers play a significant role in the onset of migraines. Migraines are not simply a headache, they are a complex neurological event with several stages and a variety of symptoms. Picture a migraine as a journey starting with the prodrome stage. This can occur hours or even days before the headache sets in. It's like a warning sign where you may experience changes in appetite, mood swings, or even autonomic symptoms. Next comes the aura stage. Not everyone who suffers from migraines experiences this, but for those who do, it is characterized by fully reversible symptoms of focal cerebral dysfunction that last less than an hour. These can include visual disturbances such as zigzag patterns or spots in your field of vision. Some people may also experience unilateral paresthesia, which is a sensation of pricking, tingling, or numbness, as well as weakness or aphasia. Then comes the main act, the headache. This is typically unilateral, pulsating, and can range from moderate to severe intensity. It's not just any headache. It's a headache that can last from 4 to 72 hours and is often so severe that it interferes with your daily activities. It can be aggravated by routine physical activity and is often accompanied by nausea, vomiting, and sensitivity to light, sound, and even smell. Finally, we reach the postdrome stage. This is like the aftermath of a storm. You may feel drained or washed out, though some people report feeling mildly euphoric. Now, migraines can be classified into 3 types: common, classic, and complicated. A common migraine does not have an aura stage. A classic migraine includes an aura that is followed by the headache within an hour. A complicated migraine, on the other hand, is accompanied by severe or persistent sensory-motor deficits. So there you have it, from subtle changes in mood or appetite to severe neurological symptoms. Migraines can manifest in many ways and vary greatly from person to person. Understanding these signs and symptoms can help you better manage these debilitating events and seek appropriate medical attention when needed. While there's no cure for migraines, there are strategies to manage them and reduce their impact on your life. This is where the management of migraines comes into play. Migraines can be triggered by various factors, ranging from stress and hormonal changes to certain foods and sleep patterns. Therefore, one of the key strategies in managing migraines is to understand and avoid these triggers. Keeping a headache diary can be helpful in tracking and identifying your personal triggers. When it comes to medication, the approach varies depending on the severity and frequency of the migraines. For mild to moderate migraines, non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and naproxen, are often the first line of defense. These medications can help alleviate the pain and inflammation associated with migraines. For moderate to severe migraines, triptans and ergots are typically recommended. Triptans are considered the most effective, as they can help to constrict the blood vessels and block pain pathways in the brain. Ergots, on the other hand, are generally used if the migraines are prolonged and not responding to triptans. For those experiencing frequent severe migraines that impact their quality of life, prophylactic treatments may be advised. These include anticonvulsants and tricyclic antidepressants, which can help to prevent the onset of migraines. While migraines can be challenging to manage, understanding your triggers and having a treatment plan in place can significantly improve your quality of life. To sum up, migraines are a common but complex neurological condition with a variety of symptoms and triggers. They affect more women than men and can be debilitating, lasting from 4 to 72 hours. Theories of their cause range from cortical depressions to genetic contributions. Symptoms can vary and include auras and severe headaches. It's important to identify potential triggers and manage them appropriately. Remember, if you're struggling with migraines, you're not alone, and there are strategies and treatments that can help. Thanks for tuning in to MedSign Health 360. Before we wrap up, we have a small request. Please subscribe now to join our MedSign Health 360 community. Your support goes a long way in helping us continue our mission to educate and inform. If you found this video helpful, give us a thumbs up to encourage us to bring more interesting, challenging, and high-quality videos to everyone. Our channel has many more videos to bring you crucial, latest, and systemic medical and health knowledge with a simple approach to everyone for better health and a better life. Stay tuned, and thank you for being a part of our community.